Hi friends, this is Sujit. Today we are going to learn about blood pressure. Generally, you have heard the word BP. What is BP? To move the blood through the network of vessels, a great deal of force is required. The force is provided by the heart and is at its highest when its ventricle contract, forcing the blood out of the heart and into the arteries. Then there is a drop in the pressure as the ventricles refill with the blood for the next beat. So BP is always measured in the upper arm artery. BP varies throughout the blood, so a standard place must be used so that a person's blood pressure can be compared over a period of time. Doctors measure the blood pressure (BP) with a device called sphygmomanometer. There are two pressure readings. One measures the strongest pressure during the time blood is forced out of the ventricles. This is called systolic pressure. For a healthy young adult, it will be 120 millimeters of height. The second reading is taken during the resting period. As the ventricles refill the blood, this is called daistolic pressure. It will be 80 millimeters of height. BP would change according to the activity in which the person is engaged, such as resting, walking, and running. People who have high BP during resting period are said to have hypertension. Discuss with your friends, teachers about low blood pressure. Blood pressure is one of the vital signs together with respiratory rate, heart rate, oxygen saturation and body temperature. And healthcare professionals use a evaluate a patient's health. Normal resting blood pressure in an adult is approximately 120 millimeters of mercury. Systolic over 80 millimeters of mercury. Daistolic denoted as 120 by 80 millimeters mercury. Globally, the average blood pressure age standardized has had remaining about the same since 1975 to the present at approx to 127 by 79 millimeter in men and 120 by 122 by 77 millimeter in women. Although these average data mask quite large divergent regional trends. Traditionally, blood pressure was measured non-invasively using auscultation with either an aneroid gauge or a mercury tube. Auscultation is still generally considered as to be gold standard of accuracy of invasive blood. However, semi-automated methods have become common in these days, largely due to concerns about potential mercury toxicity, although cost, ease of use, and applicability to ambulatory blood pressure or home blood pressure measurements have only influenced this trend. Early automated alternatives to mercury tube were often seriously inaccurate, but modern devices validated to international standards achieve an average difference between two standardized reading methods of 5 mm or less and a standard deviation of less than 8 mm head. Most of the semi-automated methods measure blood pressure using oscillometry. Blood pressure is influenced by a cardiac output, systemic vascular resistance, and arterial stiffness, and varies depending on situation, emotional state, activity, and relative health or disease state. In the short term, blood pressure is regulated by baroreceptors which act via the brain to influence the nervous and endocrine system. So, Blood pressure that is too low is called hypotension. Pressure that is too consistently high is called hypertension. And normal pressure is called normotension. Both hypertension and normotension have may causes and may be sudden onset or of long duration. Long-term hypertension is a risk factor for many diseases like heart disease, stroke and kidney failure also. Long-term hypertension is more common than long-term hypotension. Disorders of blood pressure. Disorders of blood pressure control include high blood pressure, low blood pressure, and blood pressure that shows excessive or excessive fluctuation.
If you need like this important matters, please subscribe my channel, like and share it. Thank you everybody.